Hello, my name is Paul Leong. I'm a facial plastic surgeon practicing in Pittsburgh, Pennsylvania. I'm going to talk a little bit today about using a new product, Restylane Silk, to treat two goals: volumization of the lips and also treating these what we call perioral lines, or these little vertical lines mostly on the upper lip. This is a complaint that's pretty common with patients. Patients, as they get a bit older, they see some reduction in the volume of the lips, and they see the formation. Sometimes traditionally they're called smoker lines, but it's really not necessarily to do with smoking. Smoking probably doesn't make it, perhaps can make it a bit worse, but plenty of people who've never smoked a cigarette still have these little radial vertical lines on their lips. And so Restylane Silk is a great new product. It's the only product that's FDA approved for both volumizing the lips and also treating these radial lines in the lips. And there's a number of different treatment modalities that can be used to address especially these vertical lines above the lips. You can do sort of a laser treatment. We often do some laser resurfacing in our practice that works pretty well. You can do dermabrasion in that area. You can also do sort of a superficial treatment with Botox, sort of microdroplet Botox, and it can work pretty well as well. So every patient, like so many things in facial plastic surgery, every patient's sort of a unique challenge, and it's a matter of coming in. We discuss with our patients, well, there are these different options. There's always subtle pros and cons with these options, and then we pick. But that's a list of the various sort of things in our armamentarium to address vertical lines above the lips. So we have a terrific patient today. We're going to go ahead and show you how we use our microcannula technique. We do not inject fillers ever with needles. Microcannulas, we find, result in less bruising, tends to be more comfortable for the patient, and we think we get a superior cosmetic result as well. So I'm going to demonstrate using the microcannula technique to inject Restylane Silk to volumize the lips and also to address some of these fine lines in the upper lip. So let's get started. Thanks very much. Okay, so we're going to begin injecting now with the microcannula Restylane Silk. We're going to treat all of the quadrants of the lip, and we're also going to treat some of these perioral or radial lines on the upper lip. Fantastic. Okay, so I'll have the patient look over towards me a little bit, and again, we've volumized this quite nicely. We're going to put a little bit more on that side. Turn a bit away from me. And again, we're using the microcannula. Everything in this procedure is designed to make the patient more comfortable. Okay, so now we're going to go ahead and finish up, and we're going to inject a little bit of filler in the lower lip. In general, for a female Caucasian patient, the upper lip should have a ratio of about 1/3, the lower lip about 2/3. Of our lips, and we've also improved substantially, I'd say, the lines above the upper lip. Good. No, that's perfect. Kim, so what do you think?
I think it's great. Very natural. Sorry, yes, very good.
Good. Super good. Thank you so much for your attention. So that was Restylane Silk, demonstrated as well as a dental block and the use of microcannulas. So thank you so much for your attention.